Hey, welcome back, everyone. Last year, there was a lot of confusion around health insurance, and this year, it seems that many people still don't know when, where, or how to purchase it.
Exactly. So to help clear up some of the confusion, Mike Tilton from Blue Cross Blue Shield of Arizona is here to help us better understand our health insurance options. And Mike, we need help. A lot of people need that. So why is Blue Cross Blue Shield kind of getting out there and educating people?
Well, we've been serving the state of Arizona for 75 years. This is actually the year of our 75th anniversary. And the reality of it is we live and work in these communities. And, you know, we were talking earlier, you know, my son plays baseball, my daughter plays softball, and I'm out at their games. You know, we're out in the community. People are asking us questions because they just don't know. And quite frankly, in addition to obviously providing insurance and taking care of people, we really feel it's part of our responsibility as a community steward to really make sure that, you know, Blue Cross Blue Shield of Arizona is out there making sure people understand what their options are.
Definitely. And so how soon can people sign up, and what's the time frame like for it?
Enrollment actually opened up this weekend. So it started on November 15th, and they can actually enroll up until February 15th in what they call the open enrollment period, which means you can change plans, enroll in plans freely throughout that time. It's important to understand those time frames because once February 15th passes, they have to wait for something called the special enrollment period in order to purchase insurance or change insurance. And those are things like a divorce, a relocation, loss of coverage through an employer job, something of that nature, to do it outside of this enrollment period.
And I think when the initial enrollment period came, I think there was so much confusion. People were hearing so many things that maybe this next enrollment period may be a little bit more smoother because people are starting to understand it more. But they may be thinking maybe this is too cost. You know, the cost of it may be too much for me. Is it affordable, or is there options? What are we walking into?
Yeah, I think there's a lot of different things that people need to contemplate. Number one, you know, there's a lot of young people that, you know, go without insurance because they just don't think they're ever going to need it. And, you know, reality of it is driving around Tucson, you know, people hiking, there are people are riding on their bicycles. You know, you can be young and invincible and still get injured and need insurance, and those sorts of things can be a big financial setback. So those people need to contemplate what the lifestyle cost of that is going to be. But also for people, depending on your income level, you can actually qualify for federal subsidies, which will help offset the cost of those health insurance premiums. They can get that information. We actually have set up a website called getinformedaz.com, and they can actually go on that website and they can get information on what those potential subsidy levels could be to help them defray some of that cost. They can also call us and we can help walk them through it. But then also Tucson has a big stable of well-educated brokers and insurance consultants that can help walk them through their options, and they understand all of the different federal qualifications as well as the different plans that are available.
Yeah, so we're talking about all the young people, and I mean, obviously they think they're invincible, right. So they're resisting it. What would you say to them to encourage them, you have to get health insurance? It's important.
Yeah, well, you know, exactly, because there's so many things that happen in your life that are unplanned, right? I wish we all had a crystal ball, but we don't. So the reality of it is even young people can get injured. But with some of the new changes to the benefits that are mandated by the state, they actually include things like preventive coverage. So if you want to get a physical, you may be a young couple thinking about a family, you want newborn and maternity coverage, those things are included now. And even things like prescriptions. You know, young people take prescriptions too for things like allergies, et cetera. So all of those different things are included in this plan. So even if you don't have a sickness or you're not ill, it's still an important thing to have, just like you'd have homeowners insurance or car insurance. So we want to make sure people think about what their needs could be in the future.
Now, if we already have insurance, is there anything we need to be doing, or should we know?
Well, yeah, there's a couple things you definitely need to be doing. I think obviously if you're happy with the carrier that you're with, obviously you want to think about the plan design that you have and think, okay, am I anticipating additional costs this year? Again, maybe I'm thinking about starting a family. You need to think about whether your physician's in that network, because the networks change, and make sure that, you know, your doctor's available, or if you're thinking again about some different care that you might need, that there's a physician in the network that can help cover you. And also you just need to go back and make sure that you're, you know, maybe if you weren't subsidy eligible for last year, that you're subsidy eligible moving forward. So go back and verify whether that's available to you. And again, we can help people. They can get a lot of that information on getinformedaz.com, or they can call in. We encourage people to call in, and we can help them understand what their different options are.
Excellent. And once the light does go on, what can people expect once they sign up for this?
First off, they can expect a lot of communication, because one of the nice parts about the law is it has mandated a lot of different levels of communication, and that we communicate to people in terms that they can understand, because insurance is not a topic that's familiar to everyone. So they'll get a lot of communication from their carrier. We tend to make a lot of outreach to new enrollees, but they can expect coverage for a lot of things that maybe they hadn't contemplated in the past, for things like wellness coverage, newborn maternity coverage, prescription coverage, and those different options that weren't necessarily always available in the past.
Well, let's kind of crunch this back down one more time. Give us the dates that enrollment is and what's that date we need to get it done when this is no longer open.
Well, it started on November 15th, so that was your starting point, so it's available today. It'll run until February 15th for those people that are enrolling during this time period. Again, if you wake up in May and maybe you've lost coverage through your employer, you're relocated to Tucson, you've lost your coverage because of a divorce situation, you can then make an enrollment during that period of time. But really, it's up until February 15th if you just want to basically choose a plan for yourself and your family or make a change. It's a really important fact we want to make sure we get out there, because a recent study from Kaiser, the Kaiser family group, actually showed that 9 out of 10 people didn't even know that this was the open enrollment period.
Oh, wow.
So we can't speak enough to the fact that it's important that people get out there and understand what's available to them and that this window will close.
Definitely. Well, we want to thank you and Blue Cross Blue Shield for coming on and educating us and turning on the light a little bit more.
Well, thank you very much for the opportunity. I'm very excited to be celebrating our 75th anniversary here in Tucson and excited to be a part of the community.
Excellent.
Happy anniversary.
Thank you very much.
Back anytime.
Thank you.
Open enrollment with Blue Cross Blue Shield started on the 15th and goes until February 15th, 2015. For more information, call 877-511-2227 or log on to getinformedaz.com. Again, that's 877-511-2227 and getinformedaz.com.